What is diabetic foot syndrome? What is diabetic foot disease? Yes, I am holding a leg. I'm sorry that it is not a Black African's leg, but it will do. So, diabetic foot disease or diabetic foot syndrome. It's one of the most serious complications of diabetes mellitus. Yes. Now, what is the definition? Well, diabetic foot disease is a constellation of symptoms and signs. You have soft tissue damage. So the skin, the soft tissues around the foot and the lower limb itself are affected. There are ulcers, there are wounds. Now, these wounds can be so deep as to eat into the bones of the leg and the foot. Yes. And in addition to that, we also have nerve damage. We have vessel damage. And so the blood flow to the leg, to the foot, as well as sensation around the leg and the foot is either reduced or even gone. And what does that mean? Yes, it means that that person with the diabetic foot disease or diabetic foot syndrome is prone to developing more and more, yes, you guessed it, more and more injuries because they can't sense it. They can't feel, isn't it? So whenever they hit things, new ulcers develop, eating deep into the leg and into the foot. And what does that mean? I'll tell you later. Hi, I'm Dr. Hadiza Marlia Suleiman. I see a lot of diabetic foot disease patients in my clinic. I'm a plastic surgeon, and you know we love beautiful things. And so when we see these wounds, we wish that they had not developed in the first place. Thus, the reason why I'm speaking to you today about the diabetic foot syndrome and how to prevent it. Did you know that about, or should I say up to 25% of patients with diabetes mellitus will develop diabetic foot syndrome at some point in their lives? I mean, hey, that is a quarter of them. It is a large number. And what does that imply? It implies that these people are more prone to what? You guessed it. Chop, chop. Amputation. Amputation of the digits, the toes, isn't it? The foot, part of the foot, the whole foot. Part of the leg, the whole leg. Hey, sometimes even up to the level of the hip. It can be that bad. And so you need to know whether or not you're a diabetic patient listening to this live, whether or not you have a patient, whether you have a relation, a family friend with diabetic foot disease, diabetic foot syndrome, or diabetes mellitus. This live will be helpful for you in educating them on how to prevent diabetic foot disease. Maybe they might have developed it in one limb, maybe in both, but let us try and prevent it from getting worse or from them developing new ulcers in one or more of those limbs. Okay? So, first of all, how do we prevent it? Are you the kind of person that smokes? Do you smoke? Well, if you smoke, then just know that you're worsening your condition. If indeed you have diabetes mellitus, because already your blood vessels are so narrow, they're so narrow, okay? Because of all the metabolic changes that are taking place because of this metabolic condition called diabetes mellitus. And so by smoking, that nicotine, that tar, all those toxins in that cigarette, smoke, are further worsening your blood vessels to your leg. And so it is making you prone to developing diabetic foot syndrome or diabetic foot disease. And so what do? I should quit smoking, shouldn't I? Yes. Now, I know I have diabetes, but I don't go for follow-up at my endocrinologists. I don't go to measure my fasting blood sugar regularly. I don't have a glucometer at home. Ha, that is bad. No glucometer to measure my blood sugar levels. Why? Why are you making yourself worse? Okay, maybe I even have another disease in addition to diabetes mellitus. Maybe I'm, as I said, maybe I'm hypertensive. Maybe I have asthma or some other chronic disease or some other ailment that may even worsen my diabetes mellitus. Am I seeing the relevant doctors for these conditions? Am I? Ask yourself, are you seeing the relevant doctors for these chronic conditions? If you're not, you need to be seeing them and you need to be taking your medication if indeed you have any ailment. That will also reduce your chances of getting diabetic foot syndrome. Okay? Now, how about the care of your foot, your leg? How do you take care of it? Now, did you know that diabetes mellitus patients are not... Oh, I forgot something before we go on. Are you a fatty bum like me? Are you fat? Are you obese? Are you overweight? Well, you need to lose weight. You need to lose weight because that is also still worsening your chances of developing diabetic foot disease or diabetic foot syndrome. Yes, your drugs, religiously take them. Your anti-diabetic agents, please and please and please, religiously take your anti-diabetic drugs. Inspect your feet every single day. Can you see this foot? Can you see this Caucasian foot? Look at your feet every day, okay? Remove your socks. Look at your feet every day. Inspect the dorsum. Inspect the plantar aspect. Inspect the sides. Inspect in between the toes. Inspect, okay? Check the back. Okay, maybe you might not be able to check the back, right? Okay, how about you use a mirror? Use a mirror, okay? Use a mirror to see the back, of your leg. Do you have some form of visual impairment? You can't see very well. Maybe you're partially blind because many diabetic patients are elderly. Maybe you have some ocular impairments. Then get a relation to inspect that leg for you, okay? It will go a long way. Now, why every day? Yes, as I mentioned before, diabetic foot disease patients or diabetes mellitus patients that have complications may have some impairment in their sensation. Yes, because their nerves are not working optimally. And so they may have developed some injuries around the foot that they may not have seen, okay? And so by inspecting it every day, you will be able to pick up some abnormalities of the foot. That foot, you may see some cracks around this part. You may see some calluses, some hard portions of the sole of the foot. You might see some ulcers, some wounds in between the toes. You might see an abscess, some pus collection. You might see some wrinkling. Any abnormality, corns, calluses, cuts, bruises, pus, abscesses, okay, blisters, you name it, any form of abnormality on that leg, as soon as you notice it, please, you need to get to your doctor. You need to get to your podiatrist. If you don't have a podiatrist, podiatrists are actually foot doctors. If there is none, then run to your plastic surgeon, run to your endocrinologist and make the complaint so that they can refer you appropriately for the treatment that you need. Now, what else can we do? Okay? Should I be walking around the house barefoot if I have diabetes mellitus? Why should I? You need to wear what? You need to wear shoes even if you are in the house. Now, for my viewers who are interested, I will, or should I say, I intend to have another live where I demonstrate to you the kinds of shoes you should wear if you are diabetic. some of the characteristics of the kinds of shoes you are supposed to wear if you are diabetic. Now, if you are inside, if you're indoors, don't just think, oh no, I don't have to wear anything. You need to wear shoes. You can wear some slippers, yes, but slippers that have a hard, hard sole, so that you don't go and step on something sharp and it can penetrate a soft sole and penetrate and injure your foot or your leg, okay? So around the house, wear your slippers, not flimsy slippers, okay? Those with a tough underneath. Also, wear your socks. Always wear your socks before your shoes. Your socks. You need those socks. Let them be light colored, white, okay? Let them be loose. Let them be loose. They shouldn't be tight, okay? They shouldn't be tight. The elastic. There are some socks that have some elastic around the ankles for diabetics. Some socks even have some temperature sensors within the socks to detect if, there are abnormalities in that foot. It may just imply that there's infection in that foot. Now, you can wear some long stockings or you can wear socks. Make sure that they're loose. Now, make sure that those socks don't have seams. Make sure that they don't have seams. There's some special socks that are designed for diabetics that don't have seams. These are the seams. Okay? You find them in most socks that are not specialized. These are the seams, because sometimes the seams can form, can provide some form of friction against the skin when the person wears, when the person with the diabetic foot or with diabetes mellitus wears it. And so if the socks has seams, then wear the socks inside out, just like this, Don't say that you're going to wear the socks the right way with the seams in so that they don't damage your foot. Rather, wear them inside out, all right? With the seams pointing outwards, all right? Now, make sure that they're not constricting, as I said before. Let them be dry, okay? Change them every day. Don't wear the same socks for 1 week. Why? You're just making yourself more prone to infections. Wear your socks to bed. Wear your socks around the house if especially it is cold, okay? Extremes of temperatures like extreme cold, all right? You can wear stockings, as I said before, and if you don't have any contraindication, that is, if there's no reason for you not to wear pressure garments or pressure stockings, that is, you don't have any venous disease, you don't have any venous insufficiency, as confirmed by your healthcare provider, then you can wear compression stockings. Okay, of course, not to let it be. You should be measured for the appropriate size of your compression stockings. All right. Now, should you wear garters? No, don't wear garters. Or hosiery that has seams, as I mentioned before. And your footwear, as I mentioned, I'm going to do a different video, a different live on the kind of footwear. There are special diabetic shoes that are sold online. Then there are also special shoes that are designed depending on the kind of the part of the country or on the part of the world that you are living. Some places have their own specially designed diabetic shoes because these shoes need to fit well. Okay, they need to be, highly aerated. They need to be padded. They need to be comfortable. They need to be able to protect your feet. All right, and so they need to be roomy. They should be able to protect your foot from heat, from extremes of temperature, from cold, from heat, from the hot pavement. All right, they should be made of usually leather, or canvas, but there are other materials that can be used to make these shoes. Now, those shoes, you should always shake them out before you wear them, of course. And as I said before, they're usually padded. They keep the foot warm and dry. Now, I mentioned that you shouldn't put your shoes without your socks. because, if there's extra moisture, the advantage of the socks is that it will help to absorb the moisture, isn't it? And so you will not be prone to developing more and more fungal infections. And, if, as I said before, it's hot, don't go barefoot. Don't just go and wear your flip-flops. That's not good. Or open shoes, okay? You need to protect your shoes adequately, especially if you have some impairment in your sensation or in your blood flow. Now, how do you wash your feet? How do you wash your feet? You wash your feet with lukewarm water, not hot water, not excessively cold water, okay? Lukewarm water. How do you check the temperature of your lukewarm water? You use your elbow. Just dip your elbow in the water because, yes, sometimes your fingers might be affected by the diabetes mellitus. You might not be able to, feel well enough. And so the water might be extremely hot or extremely cold. So use your elbow to check the water, make sure that it's lukewarm, and you use that with a soft sponge, like a baby bathing sponge, and wash your feet in between the toes. Wash it very well. And then, of course, after you have finished, you should dry your foot with a clean cloth. Dry in between the toes, mind you, dry in between the toes. And yes, you should apply your moisturizer, your trusted moisturizer. This is Vaseline, one of the best moisturizers in the world, if you didn't know. So what do? You apply the Vaseline around the foot. Make sure it's well moisturized. Okay, it's well moisturized. But avoid putting the Vaseline in between the toes, okay? Avoid it in between the toes because it might get damp, might get, wet, and that might make your foot more prone to developing those fungal infections. And we don't want any of that, do we? Now, protect your feet at all costs. Do not use a hot water bottle if it's too cold to warm your feet. Do not use hot cushion pads. Do not self-medicate. If you see any abnormalities, go and report to your doctor. Don't say you're going to use sharp objects to scrape those calluses. Don't say you're going to use something like this, sharp object to scrape those calluses around the sole of your foot. Please don't do that. That is dangerous. And you're going to promote a new ulcer if it wasn't there already, which could get infected even before you get to the hospital. Okay? So please do not do that. Always take care of your foot. Now, how do you cut your nails? How do you cut your nails? Yes, you should make sure that you cut your nails. Let me show you this. Make sure that you cut your nails straight across, okay? Straight. So straight across. Straight across. Don't curve the nail clipper. Don't curve the nail clipper so that if the new nail is coming out, it will not curve into the soft tissue of the nail. Just straight cut across. And then, of course, use your nail file. Use your nail file. Use your nail file to smoothen out the edges. Smoothen out those rough areas that you've already cut. Okay, smoothen them out. Smoothen them out. Yes. Now, what else have we done? Oh yes, please do cut your nails at least once a week with those clippers. Okay, don't use a razor blade. Use nail clippers. And as I said before, do not use any kind of heater, any radiant heater. Now, keep the blood flowing to your feet. Put your feet up when sitting. Elevate your feet on an elevated area, maybe like a stool. When you're sitting, wiggle your toes, and move your ankles, several times a day. Move your ankles several times a day. Don't cross your legs for too long a period, okay? Don't cross your legs for too long a period. Wiggle around, move around. Don't stay in one place. Now, if you have any abnormalities of your foot, because some diabetic patients have some abnormalities of the foot that might require some surgical intervention by the orthopedic surgeon, by the plastic surgeon. So if you have any of those abnormalities, make sure that you see your doctor, your surgeon, so that they can operate on the appropriate abnormality as soon as possible. All right. Now, of course, mild physical activity. Make sure you do some mild exercises. All right. And of course, you need to go for regular foot examinations. Go every year if you're diabetic. Go every 3 months if you have a podiatrist nearby, for the podiatrist to check your feet. Why not? Go to a specialist, plastic surgeon. Let them check your feet. Let them check for abnormalities. If you are a diabetic, you know that one or both of them can be affected. If you have had a history of diabetic foot in one foot, you are more likely to develop diabetic foot in the other foot. So don't take it for granted. Now, what else have we not talked about? Don't use adhesive tape on your foot. Some people advocate using adhesive tape. It helps to reduce inflammation around the foot, but please don't do any of those unconventional techniques to prevent yourself from getting diabetic foot or to help lessen the effect of diabetic foot. It's not going to work. It hasn't been proven to be effective. It's still a work in progress. And so you should take care. Now, I think I have covered everything so far on prevention of diabetic foot, but let me just check one more time. Yeah, I think I have. So be careful, be careful, be careful, be careful. And please don't end up like Adele over here or over here. She came up in previous live streams. She got diabetic foot and she didn't know, and it was drama all the way. I'm Dr. Hadiza Marilia Suleiman, your favorite holistic reconstructive surgeon. I will see you again in my next live stream. Bye.